an orthopedic surgeon, and we're going to talk about hip pain. When should someone stop trying to manage hip pain?
Yeah, well, I think most folks themselves, they try to manage it themselves with some rest, activity modifications, maybe some over-the-counter medications. Those things are all reasonable. For some folks, eventually, though, the pain may be persistent, maybe it's more severe and worsen over time, may limit their sleep or ability to function or go to work. And so those would be indications where you may want to start seeing somebody to get worked up further.
And how do you sort through all of that?
Yeah, well, I guess the first thing would be it just starts with the conversation. You want to learn a bit more about the problem, maybe what aggravates it, makes it worse, where's the pain exactly located, those sorts of things. And then we move on to an exam where the patient, we can kind of go through different maneuvers, see what makes it better, what makes it worse, and kind of differentiate. It's like, is this truly in their joint, maybe some soft tissue problem about the hip, or maybe it's referred to someone with the spine. And then in addition to that, we usually get some imaging, typically x-rays, but sometimes advanced imaging like an MRI or CT for specific cases, trying to root out what we think the actual problem is, and then we can have that conversation about what to do next.
Okay, and what would the next steps be?
Sure. Most often the time it's conservative management, so that's either some therapy, either some anti-inflammatories, perhaps an injection, those sorts of things, and then talking about how is this affecting their life. So for most folks, we can treat it with just their symptoms. Sometimes those things fail, and if that's the case, then we can have other options, and we talk about things like joint replacement.
Yeah, and then they're doing this outpatient in some times as well. So thank you, Doc. We're back on the Ortho Nebraska halftime show at Elkhorn with Bennington and Elkhorn North right after this.